Robertson, the Director of Services. She's going to be speaking about the Victim Assistance Program. Thank you, Chelsea.
Thank you. Hi, everybody. My name is Chelsea Robertson. I'm the Director of Services at Victim Assistance Program. Really excited to get to come out and speak with you all. Thank you guys for inviting me out and everyone else for taking a few minutes at the beginning of your meeting to listen to me. So I'm going to go into a little bit about victim assistance programs and a broad overview of the services that we offer to residents in Summit County. But just kind of wanted to gauge the room a little bit. Has everyone here heard of victim assistance program? Has anyone not heard of victim assistance program? No? Okay, cool. All right, so I'll give you a little bit of information about us. We have been in operation for nearly 50 years. We were founded in 1972 by Dr. Reverend Bob Denton, who at the time had looked around at services that were being offered in our community for offenders and for going through the criminal justice system. And at that time, I think that there were found to be 33 services for reentry, but no services that were geared towards the victims of those crimes. So he really saw a need and a gap in the community to be able to bring service to the victim population within Summit County. So he was the one that really fought to get us involved with the criminal justice system, being more heavily involved with law enforcement, and kind of grew and did grow us into what we are today. And to be able to make sure that we were able to foster and keep a hold of the really valuable partnerships that we have with law enforcement and other community partners. We focus really hard on trying to make sure that we are empowering the victims that we serve and the people in the community that we work with every day. We really make this a very much a client-led model. And what I mean by that is that we are going to try to, whether it's an initial call on the hotline or we're going out on scene at request of law enforcement or at the hospital, we really want to make sure that we are meeting that client where they are in their healing journey, right, in their process, and help to provide them with all of those options and resources that might be available to them in the county, and then help them walk through that journey at their own pace. So everything that we do is very much client-led and driven, making sure that we're not trying to push them through a course of action that they're not comfortable with. So making sure that they're really feeling empowered in the decisions that they're making and the way that their journey looks through initial phone call through the end date of services with us. We do have 3 core services that I'll talk a little bit more about that we've really honed in on, that we try to say are our specialized services, and that's crisis intervention, advocacy services, and also education. And we do provide 24-hour on-call crisis intervention and advocacy services through our 24-hour hotline and our response on scene, local law enforcement, and at the request of hospital personnel as well. So on average, we serve about 4,500 victims across Summit County annually, and that is including almost 400 on-scene responses. So we are called out by any law enforcement agency, first responder across Summit County. They can initiate a call to us for any victimization if they see a need for them to connect with our services. So we can go out on scene and provide education about what it is that we do. We connect them with those immediate resources to meet their self-identified needs like housing, transportation, safety planning, action planning, making sure that they are given information on what the next steps might look like at the through the criminal justice process. We have advocates who are in all of the municipal courts within Summit County, so that way we can do a warm handoff if we're out on scene, working with law enforcement, meeting with the victim or at the hospital, and then make sure that we're connecting that person to one of our advocates who also works within the criminal justice system and seeing them through that entire case as well. Our top victimizations are domestic violence, harassment, menacing, assault, and shooting. Those are the lead victimizations that we're working with throughout Summit County. But we do also work with people who are experiencing any type of victimization. So we respond for any sudden death, death by suicide, survivors of homicide, any unexpected unnatural death, dating violence, stalking, criminal damaging, theft, sexual assault, etc. So there really is not any there is not one victimization that we work with. We work with any victim of crime. So just a little bit more on our demographics, but like I said, we do serve all victims throughout all of Summit County. The median age is typically that we're working with are folks aged 25 to 54. Socioeconomic, 92% of the clients that we're working with are low to moderate income. A quarter of them earning less than $5,000 per year with a median household income of $15,000 to $19,000. But we do help anybody. We try to keep our services very low barrier. So as long as you identify as a victim of crime and you engage with us in services through our hotline or in person, we can work with you. So there are no guidelines for income, age. We have a child watching center within the Summit County Domestic Relations Court at one of our offices where we can provide free unscheduled child watching services for anybody who is has a criminal case or a civil case in Summit County Court. And there we see the infants as young as 6 weeks all the way up to 18 years. So we really do try to work with a wide range of individuals. So I want to talk about our core services and really the why behind what it is that we do. As I mentioned before, we provide crisis intervention services, advocacy, and education. Crisis intervention is really that immediate interaction that we have with somebody when we're first meeting with them. So if they're calling and they're in high crisis or they've just experienced a tragedy or a trauma and they're going to call our hotline, we're providing that crisis intervention support. We're allowing them to vent to us, and we're validating those feelings. We're making sure that they're safe, and we're really trying to make sure that their basic immediate needs are being met in that moment. So like I said, with transportation, or if we're connecting them to housing resources, developing a safety plan, ensure that they're able to access any information that they might need that might pertain to a criminal arraignment or a trial that's going to be forthcoming. Providing that on-scene response with law enforcement, when we go out on scene with the police, making sure that we're getting their information. Have you had a drink of water? Have you eaten? What can I call for you? So really just meeting those very immediate basic needs for people when we're arriving on scene. And then that's when it flows into our advocacy arm. So that is more of the day-to-day kind of like case management type services. Those are our advocates when they're working their traditional 8-to-4 shift. So they might be meeting with somebody to fill out protection order paperwork or going into court with them, meeting with them in person to help them fill out victim compensation applications, or working on a long-term action plan to get them where they are trying to go from here. So core advocacy, educating people on their victims' rights, and just meeting with them in person to talk a little bit more about the resources that Summit County has to offer and making sure that they get connected in a nice way. And then education, we do have our Summit Victim Assistance Academy. We, through the Summit Victim Assistance Academy, we do offer training to both people in the community and other professionals. We go out and give presentations, we have customized trainings, but we also offer an essentials course for people from the community. Can come in and take a, like, Victim Advocacy 101 to help educate the community a little bit about what it is to provide advocacy and crisis intervention services. This is for our law enforcement friends here. But this is where our main office is. We're at the corner of Main Street and Bowery, with our parking lot on Bowery, which is a little confusing. But we're right downtown, and this is where our main office location is. But as I mentioned, we actually have 6 office locations. So we have our main office here. We also have our offices on in each of the municipal courts, so Stowe, Akron, and Barberton. Have office space within the Summit County Domestic Relations Court, where we assist people in getting protection orders, or people, or provide that child watching service I was talking about for anybody who's going through a court proceeding. We can offer that service as well. We also have our office in the Akron Police Department Detectives Bureau, and that is where all of our after-hours staff work out of. So we are manned every shift, 4 to midnight during the week, midnight to 8, on the weekends as well, 8 to 4, 4 to midnight. All of our advocates take part in an on-call rotation so that they always have level of support to be able to respond to the community and the needs. Where other office locations are currently held within. I know that was a really quick presentation on everything that we do, but do you guys have any questions for me or anything that you would like to know more about?
How many staff do you have?
I like to say we have 40 when we're soaking wet. So I think when we're fully staffed, we have about 40, but right now I wanted to say we're at like 32 or 33, and that includes administrative staff.
And where does all your funding come from? I assume grant-driven, but...
Yeah, about 92 to 95% from grants and foundations. We do receive some through fundraising initiatives and individual donors as well.
And do you refer out people who you work with to other community resources like counselors, faith-based resources, legal services, or do you do it all in-house?
Oh, yeah, no. So we do refer out for all of those services. We, at the moment, don't have any, like, mental health or legal resources in-house, but we do have, and that's why it's so important to just make sure that we maintain those relationships, right? Summit County is so resource-rich, so we're really lucky to have a lot of really good partnerships with those different individuals. We refer a lot for mental health resources, legal resources like community legal aid. We work a lot with the Ohio Domestic Violence Network to obtain resources as well, Catholic Charities, and other places like that too. So really trying to make sure that when we're meeting with people, really that's why it's so important for us to make sure that we're understanding what that immediate need is and then connecting them with the agency that can take them from there too. And while we're working with them, we can work in tandem with other agencies.
Thank you.
You're welcome.
And the funeral bills, you got that with that too, right?
Yeah, so we do help with funeral costs. A lot of times we help connect people with victim compensation. So if there's a need for funeral assistance, that's something that we can work through with the Ohio Attorney General's office application and the Ohio Victim Compensation application. We help process those. And then depending on the victimization, sometimes we're able to tap into other funds that can help pay for those services as well.
Do you offer emergency housing assistance?
We do not have a shelter. We do have a very small pot of money for victim emergency funds that are just general funds for victim emergency. And out of that, we can help people with transportation costs, Uber, a lot of times, hotel stays maybe until we can get them into more permanent housing. And we do work alongside of other shelters and, to help transition them out of a hotel situation and into like a safe shelter. We do have some grant money that allows for flexible financial assistance depending on victimization. So with our flexible financial assistance program, sometimes we are able to assist people with first month's rent, security deposit, transportation costs, car payments, while they're getting us back up on their feet immediately after victimization.
Great, thank you.
Thank you guys so much, I appreciate it.
Thank you. All right, well, all right, we will call the meeting to order at 5:17. Can I get a roll call vote to establish quorum?
Dr. Blakeslee?
Yep.
Ms. Chafin? Dr. Cook?
Here.
Mr. Gano?
Here.
Mr. Genselsberger?
Here.
Ms. Hayes?
Here.
Mr. Karan?
Here.
Ms. Colner? Here. Mr. Lowry?
Remote?
Mr. McGuire?
Here.
Dr. Mamonis? Mr. Senderak?
Here.
Mr. Snell? Mr. Somerville?
Here.
Dr. Varian? And Ms. Williams?
Here.
Thank you.
Great, thank you. Quorum is established. Can I have a motion and a second to conduct business by voice vote unless a roll call vote is specifically required by our bylaws, state law, or is requested by a member of the board?
Second.
Can I have a roll call vote?
Dr. Blakeslee?
Yes.
Dr. Cook?
Yes.
Mr. Gano?
Yes.
Ms. Genselsberger?
Yes.
Ms. Hayes?
Yes.
Mr. Karan?
Yes.
Ms. Colner? Yes. Mr. Lowry?
Yes.
Mr. McGuire?
Yes.
Senderak?
Yes.
Mr. Snell? Mr. Somerville?
Yes.
Dr. Varian?
Oh, he just stepped out.
And Ms. Williams?
Yes.
Thank you.
Great, thank you. Motion carries. All right, can I have a motion and a second to approve the Board of Health meeting minutes from June 11th, 2026, please?
Second.
All right. All those in favor?
Aye.
I forgot to say discussion. Sorry, guys. Any discussion? All those in favor?
Aye.
Aye.
Any
Aye.
opposed? Any abstentions?
Abstain.
Okay. Any public or staff comment? Okay. We do have a late filing tonight, so I will read those. Schedule D, Finance. Approve interfund transfer for FEP FY26 Fund Number 99990000427, and approve the interfund transfer for Regional FEP FY26 Fund Number 99990000428. Can I have a motion to accept Schedule E late filings, please? Second. Thank you. Any discussion? All those in favor?
Aye.
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 Any opposed? Any abstained? Okay, motion carries. Can I have a motion and a second to adopt resolution number 020-26 entitled Approval of the Consent Agenda Schedules and All Matters on the Consent Agenda? Okay. Any discussion? All those in favor?
Aye.
Aye.
Any opposed? Any abstentions? All right, motion carries. Committee report. I think the only committee report we have today is the Governance committee. Here to give the committee a report.
You want to do it?
Want me to do it?
Doesn't matter. Since you were there,
I
I'm
was-
happy either way. I'm happy to report it.
Mr.
John, do
Goodell?
we have a handout for everyone on that?
No,
Yes. No,
it's just you, I believe.
Oh, okay. Well, the governance committee met at our last meeting and, discussed several matters. Is it okay if I just read this? It'd probably be easier for everybody to understand what's going
Okay.
on. Governance committee meeting held at the Summit County Public Health, 1867 West Market Street, Akron. Called to order Thursday, June 11th, by myself as vice chair. Attendants were Mr. Snell by virtual participation, myself, Chief Craig Lee Chafin, Mr. Robert McGuire, Mr. William Lowry was a virtual participant, Ms. Sheila Williams, Dr. Mamonis, and Chris Gildesberger, the Board of Health President. Summit County Public Health attendants included Health Commissioner Christopher Parker and Director of Administration Angela Wood. We had a motion to conduct business by voice vote unless a roll call vote specifically required by the bylaws, state law, or as requested by a member of the board was presented by Dr. Mamonis and seconded by Chief Chafin. Our vote was yes, Mr. Snell, yes, myself, yes, Dr. Mamonis, yes, Chief Chafin, yes, Mr. McGuire, yes, Mr. Lowry, yes, Ms. Williams, and yes, Ms. Gildesberger. That motion carried. And then we also approved the minutes from January 21st of the Governance Committee, and that all passed with no issues. First topic of discussion was discussed as a District Board of Health member requirements to have representation on each committee and challenges with the burden of participation. Group discussion occurred and concluded the representation is not required. An amendment to the existing bylaws is recommended to remove this requirement. Discussion also occurred regarding the minimum number of members required to serve on each committee. Discussion concluded no fewer than 4 committee members. 5 recommended, noting the requirement the Board of Health President may vote if a tie occurs. An amendment to the existing bylaws is recommended to clarify this requirement. Mandatory rotation members every 2 years was also discussed. The committee agreed to maintain the 2-year rotation requirement as per the existing bylaws. The last discussion item examined the challenges with multiple committee meetings occurring on the same day following the board meeting, challenges with member participation requirements, Board of Health President, Summit County Public Health personnel with requirements to attend. Mr. Barker proposed a potential consolidation of committees to reduce the number of committees and meeting frequency requirements per current bylaws. Upon discussion, the committee's intent would be to stagger meetings if multiple meetings occur or cancel committee meetings if agenda topics are minimal. This topic will continue to be explored. No other business was presented to the committee. A motion was made by Dr. Mamonis and seconded by Chief Chafin, and the motion carried, and the committee was adjourned at 5:53 p.m.
Thank you.
Can I offer just a couple of summary
Yeah.
comments? So one of the biggest problems is there are 4 people at large, and our bylaws say those 4 people must sit on every committee, but there's only 4 of us. So that makes it really confusing, because we're the at-large people, and we basically represent townships and villages, but not really, because the cities also vote on that, but they always pick township and village people. That led to Dr. Mamonis having this scramble, because you have to have one of those people on every committee, which is kind of confusing. So basically, the committee has said, we're going to propose a bylaw change to get rid of that requirement. The other requirement is the certain number of members, which also
Right.
makes it confusing. So we're going to just lower that standard to 4, recommend it could be 5, but the chair has flexibility in it. Does that make sense? Because those 4 people, it's just like Dominic kind of left, and then we're down 1. So now what do we do? So there's only 3 of us to figure out where we all go. So I just want you to understand the problem. The last one is a Chris comment, which I think is a good one. Maybe we should look at, do we have too many committees? Can we consolidate all of this? It was all very good intention when we did this. For other kinds of reasons, we expanded it, but maybe we need to contract. So you're gonna see a change to the bylaws to get rid of the 4 at-large people. That's the gist of this. So expect that coming in the next couple of months, okay?
And you're working on that, right? To bring it
Yeah,
back to the
and
board.
I just wanted to talk to everybody and make sure that you're all on board. It just makes no sense. We always thought the townships all had to have somebody on every committee. I don't know how important that really is. We're all here at large. It still goes to the full board. Does every committee have to have one of those people? Probably not, right? So that's the idea. Is that a good summary?
Yeah, thank you, Jeff. Does anybody have any questions for the committee? Okay. Health Commissioners report.
All right, good evening. Following this meeting, the Community Health and Wellness Committee will be meeting here in the boardroom. That will be followed by strategic planning. The meetings will run consecutively with a short break in between. The Human Resource Committee is scheduled to meet on August 13th following the board meeting. The Financial Operations Committee will not be meeting in August. The second quarter non-board contract report, the strategic plan report, and the full-time equivalency report is also included in your packet. We also will be hosting the Township Association dinner on Tuesday, September 1st. All board members are welcome to attend. If you're interested, please email Dawn regarding your attendance. For program fiscal updates, I'm happy to report that we have received status quo funding for our grants for the second and third quarter. That's very good news. We are especially concerned about delays in notice of awards, specifically the HIV Prevention Fund, which we did receive, and we actually received an additional $75,000 allocation. So that's good news. We were worried about that one. Also, tuition reimbursement for our staff was also offered again by ODH. That grant is administered by the Association of Ohio Health Commissioners, and to date, the majority of the requests pertain to RHS exams. We've had 3 requests also for college tuition reimbursements. When staff seek reimbursement through this, a 2-year commitment is signed to serve basically public health in the state of Ohio. It does not have to be with our health department, but it could be with another health department in the state. On May 29th, the Office of Management and Budget published a proposal to rewrite the regulatory framework for federal dollars. A copy of the National Association of Counties analysis is included in your report, and also we provided hard copies available to you if you're in attendance today. To summarize the document, the rule outlines proposals that would become statute, so that's a change. Previously, there were guidance. Federal agencies could now freeze for up to 90 days or terminate grants midstream if they no longer align with current federal goals outlined by the administration, using criteria that differs from when the award was made. During the freeze, no defined standards, appeal process, or clarity on cost recovery is outlined in the documents during the suspension period. New prohibitions on grant funding activities would be in place with undefined terms, making grant compliance a potential challenge. Funded agencies could face retroactive cost disallowances for activities they could not have known were out of bounds. Competitive grant applications would go through a new political appointee review process with no defined standards. The rule eliminates simplified fixed amount grant structures. A good example of that is deliverable-based grant funding, which we do receive, and removes a cost accounting exemption used by nonprofits. Pass-through funding would be counted as subawards, which would trigger requirements through SAMs, so basically increasing reporting and monitoring requirements for subawardees. And OBM is also encouraging agencies to issue multi-year awards to reduce the reapplication burden. The comment period for this proposed change ends July 13th. There was only a 45-day window to provide comment on this. If this advances, the proposals would take effect October 1st. NATRO is preparing a comment to the Federal Register on behalf of public health, and the county is actually meeting tomorrow to discuss their comment. This concludes my report unless there's any questions for what has been briefed.
All right.
All right, thank you.
All right, environmental health, we do have some variances. Okay. Oh, I'm sorry, fiscal report. I just skipped right over you. I was like, you don't need to go today.
I don't have anything specific or special to report today, so if you have any questions on the monthly reports, I will be happy to take those. Otherwise, we can go to environmental health.
Perfect. Now environmental health. See, I knew that.
I know.
Evening, everybody. Sure which one. So the first one is actually an amendment. This variance was presented to board for approval in April. May or may not remember, very, very tight lot. And Mr. Trout, the owner of this property, has done his due diligence to try and meet the code as best he could. He in fact purchased a piece of this property from ODNR. However, the issue was when the system was installed, at the time that the plan was presented to us, the designer did his best to try and they always try to get the most accurate distances. At the time, this patio, which you can't really tell, there's like an upper deck, a lower deck, and then there was a patio. The patio was already torn up, and he had some trouble, we have discovered, getting the exact distances that the tank would be installed. So, it's covered. So the original request asked for a variance of have the tank installed 8 inches from the deck on the house side and 5 feet from the deck here on the lake side. And when they went to actually install the tank, there wasn't that much room. So the tank instead was installed 4 feet, 9 inches from the house side and 5 feet, 9 inches from the lake. It actually shifted over a touch. The installer also felt it was getting a little bit too close to the lake. He felt like the integrity would be better if it had been shifted just slightly. So he made that call, and in order for us to approve their installation, we needed to come back and request an amendment to the variance so that we can approve his installation.
What do you recommend?
I recommend that I don't think, it didn't change any of the distances to the neighboring properties. It really is just between these two decks. There isn't much wiggle. The difference was less than a couple of feet.
Okay. Any other questions? Great. Can I have a motion to adopt resolution number 021-26, amending the previously approved variance for Elwood C. Tyrell Jr. at 3814 Talent Drive, Green, partial ID 28-05475, Summit County, Ohio 44319, for the approval of a new sewage treatment system.
Second.
Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions? Okay. So moved.
And the second one is in New Franklin at 4933 Drive, and actually an even tighter lot. So, I don't know what else to say other than the homeowner's well is actually on a property across the street. This lot is a vacant lot owned by the house down here, and his well is down here. And then the well for this property, to the north is shown with the X. This is the, sorry. Wait, touch this. This is the existing tanks for the system, and the homeowner actually noticed when they were doing laundry that they would observe bubbles
and things surfacing over here. So there is an unknown leaching component of some sort, either a leach well or some old trenches that are no longer functioning. So what is being proposed is the MPDES system, the fully enclosed like, water treatment plant that would be discharging out to the lake. The requested variances are to install it 1 foot from the southwest property line, 4 feet from the house, and 1 foot from the driveway. It will be a better system in that what's being discharged into the lake will be treated and has an additional permit from the EPA, requiring very high standards for what can be released. And as you can see, there really are no other options. So due to the hardship, the home would need a new system or be ordered to be vacated. I would recommend approval and request.
Question, Julie. I just retired from New Franklin, so not there anymore, but I have a comment that I think the board should keep in our minds for the future and staff.
Mm-hmm.
There's a lot of people wanting to do Airbnbs out there. And I did 7 licenses before I retired back in June. And my concern is so many people utilizing these properties. I mean, it's gonna fluctuate, you know, as far as the amount of, so I don't know if we can do anything as far as putting a regulation on that, on these property owners, if it's gonna be used for an Airbnb. I don't know. It might be something we might wanna look at. But I see this as a big problem. I actually had an argument with some of the council people about this, and like, you know, I see it as a problem. And it's gonna be a big problem. It's gonna bite the city, the health department, everybody eventually, so. Just food for thought after being in the trenches.
I mean, the system will be sized for the number of bedrooms, so that's how we size it. And based on presumed maximum occupancy. So this, I don't actually know off the top of my head, but this system would likely accommodate up to at least 4 bedrooms.
So I'm glad it's an upgrade. Can you also explain to the board that once you get that EPA permit, there is an ongoing inspection component that comes with it?
Yeah, so, not only the EPA, but our Summit County code requires that these types of systems keep a service contract with a registered service provider for the life of the system. That requires 2 inspections per year and an annual sample taken of the effluent, make sure that it meets all of the standards. And then we do enforcement if they're not maintaining that.
So the homeowner voluntarily shared with you the bubbling in another area.
Right.
That can't really happen anymore because now somebody's gonna look at this every 6 months and make sure it's functioning and it's operating on a regular basis. So we're upgrading this.
And taking a sample, so.
It feels awful because it's only a foot and it should be 10 feet, right?
Yeah.
But it's much better here because there's going to be an ongoing inspection and a third party doing it with the health department.
Any further questions? All right, can I have a motion to adopt resolution number 022-26, approving and granting a variance for Stephen S. Wyndham at 4933 Coleman Drive, New Franklin, partial ID 23-05095, Summit County, Ohio, 44319, for the installation of a new sewage treatment system. Second? Any discussion? All those in favor?
Aye.
Any opposed? Any abstentions?
Can I come back and ask a question? I don't have a problem with that.
Okay, we already did discussion though, but you can ask, what's your question?
What he said about the
Airbnbs.
Airbnbs. Do we have anything written in policy with that? Is
I
that-
don't know of any code enforcement capabilities.
Yeah, not with the board, there's really no code enforcement. I don't think there would be anything that we could enforce.
I've seen it in,
Right, it would lie with the city of New Franklin.
So, and all of these communities are discussing regulation of this.
Right.
It's New Franklin who has that pending, zoning resolution of how they have to be 500 feet from another one.
300.
They're 300 now, they're proposing potentially 500. There's a whole lot of discussion. It's size for the bedrooms.
Right,
So as long as zoning enforces the number of people in the bedrooms, I mean, we all think of bath, right? The shooting and 150 kids and a big giant party at somebody's septic, right? Somebody's house that had a septic. We shouldn't have that as long as the community is aware. Julie, you're looking at this, sizing it for the bedrooms. So as
Right.
long as they regulate that, we should be fine.
yeah,
think it's
I would
good
agree.
when it's- Yeah, it's out of-
It's better than what we had, a lot better.
Right.
To extend the zoning thing though, real quick. It was charged with zoning in New Franklin, and I had a lot of problems with that after being there for so many years. I thought the ordinance was very poorly written, and nobody consult with me anyway. I was gonna be the judge, jury, and executioner, but nobody talked to me about it. But I told them, I think you should have just did an outright ban on it, because the neighbors don't want these things. The neighbors are screaming about it, and so I don't know, I think this is gonna come back later, not on us, on the Board of Health, but I think the city's gonna have a lot of problems.
Well, I can tell you that Coventry has proposed, regulations to the planning commission, and it's gone back and forth, and it's obvious that all of them don't all agree. So this is an ongoing issue with everybody,
In many
but I
health
don't
districts.
think it's a health board.
No.
No, it's not.
Because, it has a capacity for 3 bedrooms or 4 bedrooms, they should know that based on your
Right.
approval. It's a public record, and if they let more people in, well, that's their problem, and look what they do to their lake.
Right, and we're gonna monitor it. So I think for our purposes, we are covered from a health department. Okay, thank you. All right. Clinical health, medical director's report.
Well, good evening. In a minute, since we've done sort of a quick rundown, and there's lots of communicable things in the news, going to make sure everyone was aware of things that we've been evaluating. So just an update on the measles cases. So we've hit just within about 100 of where we hit for all of last year. Currently, we're at a steady state, but we're between probably like 45 and 50 of the United States. Update with that. You can see that 2026 is fine compared with the years. So still the Ebola outbreak. So the outbreak of the Bundibugyo virus in those areas of the Democratic Republic of Congo, Uganda, and also they have some South Sudan as travel advisories, although there haven't been any cases there. How it affects us in Summit County or travelers. It's been restricted that only nationals of the United States are permitted to enter the United States when they live in those countries. So, who do come in, we monitor at the health department for that 21-day period, and we're stratifying them to low, moderate. These are sort of the death count, confirmed deaths and some cases. Certainly high numbers in the Democratic Republic of Congo, but you see where that Coastal Bridge is. It's a very rural area. So the numbers sort of got out of control before much awareness came to other parts of the world. Their biggest issue that a lot of people, I think, didn't estimate is all the machines that are doing rapid testing for Ebola that are stationed anywhere in the world up until just recently. We're really testing for the Zaire version of the virus. And really only the CEPIA has recently, within the last 2 weeks, been able to compound machine and authorized set that tests for 4 different variants of the Ebola virus as well as several other hemorrhagic so that should help with our cases. New World Screw Worm, in my personal favorite, but it's sort of cool. Thankfully, far away from us, but it is reaching into the United States. The pretty fly with the bright orange eyes, but it is one of the few flies that lay maggots that actually feed on living flesh. They do lay eggs in any open orifices, so it's eyes, nose, mouth, genitals, or open wounds. And they have been known to decimate farm animals just really within days. Typically, we've seen this a lot in South and Central America, the Caribbean, Mexico. Back in the 1960s, we actually had a problem in the United States. So we're very successful with sterile fly production in mediating that and pushing it all the way down to the Panama Canal. We hadn't really had any cases in the United States. However, in 2023, we started noticing cases starting again in the Panama Canal. We've been able to trace that up back through South and Central America and obviously where we border Texas and New Mexico. So first cases, June 3rd, 2025, we've noticed in the United States, USDA has a nice monitoring board, really seeing it in cattle, sheep, goats, but there's been one dog, domesticated dog, that actually was in New Mexico, that had crossed the border, was working in the farmland, but then resided in New Mexico. So again, you see how these things spread and become issues. So really a lot of the information is being pushed out to veterinarians, farm workers, really investigating the cattle so that obviously transporting them to other states is helping spread. The other thing, picking out a maggot, you throw it on the ground, it's going to continue to spread. They've had incidences where people have been infected, and even doctors pulling them out, putting them in biohazard, but they actually need to be submerged in rubbing alcohol to kill them. They reproduce in a biohazard and become so, and they can really decimate livestock. So, that's very interesting. They've produced over 5 million of these sterile flies. The females only mate once, so they flood with all these male sterile flies and have been very successful in the past. And here's the map. You see them in Mexico and Texas, where the borders are. Active cases are the orange, blue are where they will be treated, and over 32. Next is Lyme disease. We talked about before last year, the season, so it's been a 74-fold increase in Ohio. So, what are we doing about it? So, what's changing? Obviously, it's a black-legged tick, but within all of Ohio, 31% of submitted black ticks that have been tested have been positive for Lyme. In Summit County, it's been 6% positive from those. So what's anticipated come 2027, it will go from a low incidence state to a high incidence state. What that takes is has to be greater than 10 cases per 100,000 population for 3 consecutive years. So we're just getting to that point where we hit that 3-year mark, which we. So what's that change? It changes reporting for us from high incidence state. And it changes some of the semantics in the backward here. The biggest thing, again, from a medical standpoint, is considering post-exposure prophylaxis for anyone within 72 hours of having a tick bite. That is automatically prophylaxing because we're approaching over 50%. And last of poopery, or if this is poopery, I guess, so cyclosporiasis, which is a parasite. It's fecal oral transmission. You've heard in the news about the outbreak. In our area, it's really sort of southeast Michigan, bordering into northwest Ohio, so really Lucas, Wood counties have had the highest count. As of July 2nd, Ohio is getting 177 cases. Of those, 171 have been since June 20th. So that's really where they're feeling like this outbreak is stemming from. Typically, in a year in Ohio, 70, 80 cases. Summit County, it's only less than 5. Typically, it's travel associated, people going to tropical environments, bringing things back. They're dumping all those from our case count. We've had 7 and I think 8 technically as of current right now, and it was 3 just on the 2nd. So all those schools are being sent from hospitals, testing agencies down to the state. They're trying to do genotype testing to see what matches with all these other outbreaks in the other states, to see what's in common, and try to trace back to see where this is coming. Historically, it's been lettuce fields, fresh fruit, more being spread, it was infected with a cyclospora, and then people not washing their fruits and vegetables before consuming them, washing their hands. Interestingly, in a household, so one person has a case of cyclosporiasis, really doesn't spread within the family because it has to be 1 to 2 weeks after the school is passed that it's actually, that's where it tends to come. So we'll have to wait and see. They haven't really traced back, even though.
I have a question.
Yeah.
In the water report, can we pick this up?
It would be very interesting to see if they can. I don't think they've ever really checked. It would be most interesting, I think, probably California or Florida, where things are really, they have to host the fields because that's really so there's never been really any.
I was just wondering if we could, like in the sewage water, if we could check to see if it's rising.
We could look to see
I don't know if that would.
what the cost potentially is, but we'll look.
But I think where those things would be really meaningful is right at the outlet, because then pay from this farm and all the runoff from the water that they're, spreading manure on it.
Sure.
All right.
Just on the Ebola, you mentioned that there's a 21-day observation period of time. In Summit County, do we have many people that travel?
We had a handful of people that we were monitoring. We don't have any currently that we're monitoring. People on very limited low. So we really haven't.
It seems like it would be kind of strange to go over it in the middle of an outbreak. It's been a well-known situation.
Some come into effect, so
Okay.
But again, we have people that go for medical missions, there's all those things, so it's important infrastructure that we have then to be able to handle a lot of logistics.
Okay, thank you. All right. So I'm not missing anything. All right, there's no exec session tonight, but we will have the Community Health and Wellness meeting directly following this meeting. So we will adjourn at 5:53 p.m. I have a motion? I don't need a motion, do I? I don't think I need a motion. We'll just adjourn.
Thank you.